If you're over 70, your legs and feet might be whispering heart warnings, and nobody told you how to listen. More than 6 million Americans live with heart failure, and many of them never had dramatic chest pain. Their first clues were swollen ankles, cold feet, strange skin changes, and they thought it was just age. In this video, I'm going to walk you through 12 silent heart failure warnings hiding in your legs and feet, and simple at-home checks you can do today. One of them shows up at night and affects most people with heart failure, but almost nobody links it to their heart. We'll get to that one later, but let's start with a quick test you can do right now. This is general education, not personal medical advice. If you notice several of these signs, especially together with shortness of breath, chest discomfort, or sudden fatigue, please contact your own doctor or go to urgent care. Always stay safe. Hold on to a rail or sturdy chair if you stand up, and stop any movement that causes pain, dizziness, or feeling faint. All right, let's start with your first check. Sign number 1, the 10-second ankle press, pitting edema. Here's a simple test doctors use every day. While you're sitting, look at the front of your shin or just above your ankle. Find a puffy or swollen area if you see one. Now, with one finger, press firmly into that spot and count to 10. 1, 2, 3, all the way to 10. Then let go. If the skin bounces right back, that's less concerning. But if you see a little dent or pit that stays for several seconds, that's called pitting edema. Pitting edema means fluid is leaked out of your blood vessels and is sitting in your tissues. When that shows up most days, especially around your ankles and lower legs, it can be an early warning that your heart isn't pumping blood forward very well. So fluid backs up and sinks down to your legs. If you're already thinking, that dent stays there on me every night, please don't panic. But don't ignore it either. In a moment, I'll show you the nighttime symptom that goes with this. But first, let's talk about your feet temperature. Sign number 2, cold feet that don't warm up. Lots of my patients joke, "Doc, my feet are always cold. That's just me." But with heart failure, cold has a very specific pattern. If your heart is struggling, your body has to choose where to send the limited warm blood. It protects your brain, heart, lungs, kidneys first. And your feet fall to the bottom of the list. Here's what to look for. Your feet feel cold all day, even in a warm room. Thick socks, slippers, or a blanket don't really fix it. The rest of your body feels okay, but your toes feel like ice cubes. Quick home check. Gently put the back of your hand on the top of your foot, then on your shin. If the foot feels noticeably colder all the time, not just for a few minutes, and that's new for you, your circulation may not be keeping up. Cold feet by themselves don't prove heart failure, but cold feet plus swelling plus shortness of breath, that's a pattern your doctor needs to know about. By the way, if we haven't met before, I'm Dr. Eli Morgan, a geriatric physician. I've spent over 30 years helping older adults stay in their own homes, avoid preventable falls and hospital stays, and keep their independence as long as possible. My whole goal on this channel is straightforward. Help you catch problems early and give you simple steps to stay on your feet. If that sounds important to you, I'd love for you to subscribe so you don't miss future videos. Now let's keep going, because the next sign is one many people blame on just getting old. Sign number 3, jelly legs on stairs or hills. Think about the last time you climbed a flight of stairs or walked up a small hill. Did your legs suddenly feel weak, shaky, or like jelly, even though that same distance used to be easy for you a year or two ago? When your heart can't pump strongly, your leg muscles don't get enough oxygen and nutrients. Over time, they literally lose strength, not just tired at the end of the day, but truly weaker. Red flags. You have to stop halfway up the stairs to rest your legs. Your legs feel heavy walking from one room to another. You're avoiding outings because your legs give out too fast. One weekday is normal. A steady change over months, especially with swelling and breathlessness, is a warning light. Sign number 4, sudden weight. Gain in your lower body. If you step on the scale and you've gained 2 to 5 pounds overnight, or 5 to 10 pounds in a few days, and most of it is in your legs, ankles, and belly, that's very different from slowly gaining weight over holidays. That fast jump is usually fluid, not fat. Your shoes may suddenly feel tight, your socks leave deep marks, and your legs feel thick and heavy. Doctors consider sudden fluid weight gain a reason to call right away because it means your heart and kidneys are struggling to keep up with the extra fluid. If you're over 70 and see a fast rising number on the scale plus ankle swelling, please don't wait a month to mention it at your routine checkup. Sign number 5, blue, purple, or dusky color in your toes or feet. Look down at your toes and the tops of your feet in good light. Do they ever look bluish or purple, smoky or grayish, or darker in patches compared to the rest of your leg? That color change, called cyanosis, means your blood in that area is not carrying enough oxygen. When the heart is weak, blood moves more slowly and the oxygen level drops before it gets back to your lungs. If this color shows up often, gets worse when you sit or stand for a while, and improves only a little when you elevate your legs. It's another sign that circulation to your feet is struggling. Sign number 6, ankle swelling that keeps coming back. A little ankle puffiness after a long day on your feet can be normal. What worries me is swelling that is there most evenings, is clearly worse than it was a few months ago, or is present even in the morning when you get out of bed. If your ankles look almost normal at 8 a.m., but by bedtime they are tight and stretched, or your skin shines from the swelling, that's your body showing you that fluid is backing up. If you press on the swollen area and see that little pit we talked about, and it goes along with weight gain or breathlessness, your heart may be saying, I need help. Sign number 7, cuts or sores on your legs and feet. That heal very slowly. A scratch on your shin, a small blister on your heel, or a sore on your ankle should gradually improve over days and weeks. If instead it stays open for weeks, heals a little then gets worse again, or starts to look shiny, red, or weepy, that tells me your circulation is not delivering enough oxygen and healing cells to the area. Poor wound healing can have several causes: diabetes, vein disease, poor nutrition, but when it happens together with swelling, color changes, and shortness of breath, heart function has to be on the list we check. Sign number 8, leg cramps or heavy pain. When you walk, claudication type symptoms, this one steals independence quietly. You start walking down the block or to the mailbox, and after a minute or two, your calves cramp, burn, or feel like they're going to give out. You have to stop and stand still until it eases. Then, as soon as you walk again, it comes back. That pattern means your muscles aren't getting enough oxygen while they work. Sometimes the main problem is in the leg arteries, but weak heart pumping can make this much worse. If walking distance that used to be easy is now painful and limited, please don't just say, I'm just old. Tell your doctor exactly how far you can walk before your legs protest. Sign number 9, restless, crawling legs at night, the nighttime clue. Here's the night sign I promised you. You finally get into bed. Your legs should be resting, but instead they feel jumpy, tingly, or like something is crawling under the skin. You feel a powerful need to move them, kick, or change position over and over. For many people with heart failure, fluid builds up in the legs all day. When you lie down, that fluid shifts back toward your upper body, irritating nerves and changing pressure in your tissues. The result can be restless legs that steal your sleep, night after night. Most people never think heart when they hear restless legs. But if you have nighttime leg restlessness plus swelling and shortness of breath, it's a pattern your doctor really needs to hear about. Sign number 10, varicose veins getting suddenly worse. Maybe you've had a few mild varicose veins for years and they were mostly cosmetic. What makes me more concerned is when new bulging veins appear quickly. Old ones become much larger, more twisted and more painful over just a few months, or the skin over them starts to darken or itch. When the heart is weak, pressure in the vein system goes up. That extra pressure pushes those one-way vein valves to fail faster, and the veins balloon. Varicose veins alone don't equal heart failure, but a rapid change in your veins plus other signs on this list is your body spelling out a bigger circulation problem. Sign number 11, shiny, tight, or thin skin on your lower legs. Look at the skin over your shins and ankles. Does it look unusually shiny, like it's been stretched over a balloon? Very thin or fragile, almost see-through? Different from the skin on your thighs or arms. Chronic fluid buildup literally stretches the skin, flattening the normal pores and fine lines so it reflects light differently. Doctors use that shiny, tight skin as a visual clue that there is significant fluid retention. This kind of skin is also more likely to crack, tear, and get infected. So if your lower legs look like this, especially with swelling and color changes, it's another reason to have your heart and circulation checked. Sign number 12, numbness or tingling in the feet, walking on pins and needles. Finally, pay attention to numbness, tingling, or burning in your feet. That lasts much of the day, makes you feel like you're walking on pins, sand, or cotton, or makes you unsure where the floor is under your feet. Swelling in the feet can literally squeeze the small nerves, and poor circulation can starve those nerves of oxygen. They start misfiring, sending false messages to your brain. Over time, this doesn't just feel uncomfortable. It also makes it harder to feel injuries, heat, cold, or pressure, which increases your risk of falls and wounds. Again, diabetes and nerve diseases can cause this too, but in the setting of swelling, skin changes, and breathlessness, we must think about the heart as well. Pulling it all together, what to do next? Your legs and feet are not just far away from your heart. They are one of the best early warning systems your heart has. Any one of these signs by itself may have a harmless explanation, but if you recognize several of them in yourself, for example, ankle swelling, fast weight gain, shiny skin, and nighttime restless legs, that deserves a real conversation with your doctor soon, not when I happen to go in next year. If you ever notice sudden extreme shortness of breath, chest pressure, new confusion, or very rapid weight gain with severe swelling, that's not a wait and see situation. That's a go in now situation. If this is opening your eyes or making you think of a friend, please hit like so YouTube shows this to more older adults who need it. And tell me in the comments, which of these leg and foot signs have you noticed in yourself? Just type the number 1 through 12, or type none if you're just learning. Your answer helps me know what to cover next for you. Heart failure sounds scary, and it is serious. But catching it early can mean the difference between years of independent living at home and a sudden crisis that takes that away. We have medications, lifestyle tools, and treatments that work much better when we act before things are advanced. So look at your legs and feet today with new eyes. They may have been trying to get your attention for a long time. If you'd like more clear down-to-earth guidance like this, subscribe to Life After 65 and turn on the little bell so you don't miss the next video. And if ankle swelling after walking is your biggest worry, watch my video on ankle swelling and your heart next. It's the perfect companion to what we've just talked about. Take care of those legs and feet. They may be quietly protecting your heart.